sadly, allergies and sinus problems do not discriminate. It's an issue that can impact both the young and the old.
That's right. Dr. Kalpana DePasquale is the founder of St. Augustine Ear, Nose and Throat and Avanti Medical Spa. Thank you so much for coming on to the show.
Thank you for having me.
I think you're just the loveliest ENT I've ever seen, and I've gone to a couple of them, so they're never as lovely and smile like you.
There are probably very few females in the field, I think. So.
Well, and it's such an interesting field, too,
it
because
is.
The ear, the nose, the throat, they're all interconnected, and there's so much cool technology going on right now that can really address so many issues. So let's talk about, what do you specialize in first?
Well, we specialize in all ENT issues. So obviously we deal with, the head and neck, anything in the head and neck. So hearing loss, hoarseness, thyroid disorders, neck masses, all of the above. But specifically, I feel that our practice has a big focus on sinus and allergy issues, probably just because it predominates what we see here in Florida. So
when we were talking about, allergies, sometimes, and I experience this as a parent, you don't know if it's the cold, if it's the flu, if it's allergies, so how do you, this is the $1 million question, how do you look at those symptoms and figure out what it is, or if they're overlapping even?
And that's what's so difficult, because patients often come into us and they really don't know which entity they're suffering from. Is it a cold? Is it allergies? Is it a sinus infection? Is it the flu? So many of the symptoms overlap that it becomes difficult. One of the things that's a guideline, and again, nothing is to substitute for a doctor's advice, but one guideline is the onset of the symptoms and the duration. So that often will help us differentiate one from the other. So for example, a cold will typically last 7 to 10 days. People tend to get better even with minimal supportive care, some general medications and whatnot. A sinus infection, on the other hand, will present a little more severely with nasal discharge, facial pressure, facial pain, a fever possibly, but those symptoms tend to get worse as time goes on. And then obviously any kind of other problems like allergies may present seasonally, but they may be present all year round. So I hear people tell me, well, I have a cold that doesn't ever go away. Well, then it's not a cold by definition.
So when should they then go to the doctor? Because I get strep throat like almost every season. So the minute I get a scratch, I'm running to the doctor. And 50-50, I've got it yet or I don't have it yet. And then I've wasted a trip to the doctor.
Well, I think that's difficult because with what you do, I don't really think you need to be down with strep throat. So if I were you, I'd be doing the same thing.
Thank you. Right now I feel better. See, my husband thinks I'm a hypochondriac. Because Pasquale said.
That's right. Because the bottom line is with what you do, you don't really need strep throat, and then it's going to get you out of work. So the people that I usually see are kind of like that. They want to get back to work. They want to get healthy quickly. So, sometimes they come to the doctor maybe a little prematurely, but I don't really have a problem with that. I mean, if you're not sure, the best way to do it is to get a doctor's advice so we can head you in the right direction.
Yeah, because there's nothing worse than that sinus pressure headache when that starts, you can't sleep, you can't function when it gets to that point.
Right.
I was telling you, everybody in my family, we're like frequent flyers to the ENT. So
maybe we should come up with a frequent flyer card then.
Right, there you go.
Discount. Like my third visit is like free,
So who do you treat? Because it would be nice to have an ENT that is comprehensive and sees the whole family.
And we do that. I mean, that's what I love about my field, because we can see children, we can see adolescents, we see, the elderly, everybody. So I love that we can see everybody and treat I have many patients where I treat one person and then I've got the whole family. And I find that rewarding because obviously they trust us with their family members, and what could be more rewarding than that?
Right.
But what kind of range then also in terms of care do you provide? Everything from the simple cold to, you brought some scary looking equipment there.
I'm very familiar with this. It's not so scary to me.
So we obviously do medical management. We do ancillary testing like allergy testing, CT scans in our office as well. We provide nasal endoscopy. We have hearing tests in our office. So we have everything. But this stuff specifically is just some new technology that we use to really improve outcomes in patients with sinus problems, especially if they need to have a procedure down the line. So this one here in particular is called a balloon sinuplasty. And it's a small device, a balloon catheter that's inserted into the sinus to dilate the passageways. And this is a really new revolutionary device called the Propel stent. Get this off this here. And what this does is it's a spring-like device. It has a steroid on it. So if you do have to have sinus surgery and you have polyps or something like that, it's inserted into the sinus cavity and stays there, allowing for less packing, less future surgeries, and just better outcomes all along. So I like to use this advanced technology to get better outcomes for our patients, because that's what's great about practicing medicine in 2015.
Well, let's get right to it, because you have 2 offices in town.
Correct.
Where are they?
The first office, our original office, is in St. St. Augustine, right by Flagler Hospital, and that's at 1301 Plantation Island Drive. We opened up a new office a few weeks ago in Ponte Vedra in the Nocatee Palencia area, and that's at 145 Hilden Road in Ponte Vedra.
And what else you were telling me I love is that you have a YouTube channel.
Yes.
Your YouTube channel is?
It's actually, I don't know the YouTube channel's name, but you can find it on a link on our website. What's great about that is that we have little tidbits about ENT problems and aesthetic tips and this and that. So if it's just something you're curious about, you can just go to our YouTube channel, check it out, get a little bit of information. Or even if you're preparing for a doctor's visit, just get a little basic information before you go in. It doesn't hurt.
That's a great idea. Well,
thank you so much.
We'd like to thank Dr. DePasquale for sponsoring this segment. For more information on St. Augustine, ear, nose, and throat, visit saent.net or give them a call at 904-641-6060 or go check out their new location out over in the Ponte Vedra area.